Members of the media, members of the community who are listening to the national briefing via radio or viewing on social media, good evening. As of August 5th at 4 p.m., the Ministry of ASR was informed that we are currently at 80 active cases, 3 of which is in the St. Martin Medical Center. Over the past couple of weeks, we have been drastic increasing in the amount of active COVID-19 cases of St. Martin. As such, while government don't want to implement lockdown, it is forced to implement stringent rules limiting social gatherings at nightclubs, bars, or anywhere large crowds get together. This will be implemented in the time frame from 0000 midnight till 600 a.m., that is 6 o'clock in the morning. These will be necessary measures to bend and flatten the curve which has spiked so drastically the last days. I was informed that CDC has put St. Martin in a warning level 3. I requested Dr. Best in his elaboration to go into that matter. Although many are of the opinion that the rise in COVID-19 cases are due to the borders reopening to the US, these cases are locally transmitted. As per Aruba.com website, Aruba has 89 new cases of COVID-19 within a few days. The number of active COVID-19 cases on Aruba has increased from 92 to 146 residents and 2 visitors. Please note that this is inform all that we cannot let our guard down and must remain vigilant to the spread of the virus. As Minister of VSR, I cannot stress the importance of wearing masks, social distancing, limiting mass gatherings, washing your hands with soap, and frequently hand sanitizers enough. I would like to bring to your attention that when you see a family member or a relative, a loved one, please greet from afar instead of getting close. What we have seen and have been said lately, you have a group of asymptomatic people carrying the virus. You will not see from their how they look that they carry it, and it could be drastic for another person. So please, let's all adhere at all that what government has been telling you since the beginning of March when COVID hit St. Martin shores. These are only steps that we as community can take to ensure that we reduce the spread of COVID-19 as the fight against virus continues. I thank you. May God continue to protect St. Martin, and I would like now to pass the word to Dr. Best, Inspector General of ASA. I'm mute.
Good afternoon, listeners, the audience, everybody present, tuned in. The Minister just announced that CDC has placed St. Martin in Category 3 risk for traveling. What it means is that Category 3, that all non-essential travel, you should avoid that. The categorization varies from no restrictions at all to a total travel ban. We are in the one more to go for a travel ban, but right now all non-essential travel is not to be done. That is what CDC released. What I want to discuss a little bit more in depth is the system that has been put in place for all travelers visiting St. Martin by air, by sea, or a combination of both, that they have to go through a system that will evaluate whether they are allowed, based on health parameters, to enter St. Martin. The site is stmartinentry.com, where our tourist visitors will go through and fill out an application form. Basically, they are screened on the country where they're coming from, whether it's a high risk, a moderate risk, or a low risk country. For example, the States, United States, is a high risk country at the moment. Colombia is high risk, Santo Domingo is high risk, Brazil is high risk. Moderate risk are most of the European countries at the moment. And low risk are the countries mainly surrounding us, where we are a hub for, and the ABC Islands. That will change pretty soon, seeing the latest developments in Aruba as well. So the risk categorization is very important, that is one. Furthermore, everybody visiting the island must do a PCR test unless you are coming from one of the low-risk countries. That PCR test, the result of the PCR test has to be uploaded in the system and will be reviewed. The test itself should be performed within 72 hours before departing to St. Martin, or 72 hours before arrival, if you want to say it so. The other thing is that we are also requiring from tourists to have at least health coverage. We are looking now into expanding that to a mandatory COVID insurance. It's not in effect yet, but we're looking into that very soon as well to implement it. So once everybody has uploaded their personal information, their health information, and the travel information, they have to consent to a couple of things, amongst others, that we are allowed to examine them, assess them, conduct more testing if necessary, and also that they will cooperate with quarantining and isolation. Once they have finalized, completed the application, the system will generate a response, an email to them, whereby they can be either approved or denied. Denial grounds are usually the fact that you did not upload a PCR test, or you don't have travel insurance, or you have symptoms at the moment. So anybody who wants to come to St. Martin has to go through the system, follow this procedure, and will receive an approval to be able to come to St. Martin. This form has to be shown, what you receive has to be shown to the authorities upon departure and upon arrival, to the health authorities and to immigration in St. Martin. Passengers who are transiting, coming from Europe or from the States, transiting to Anguilla or to St. Bart's, we have a lot of people going to St. Bart's. They also have to do a PCR test depending on the country where they're coming from. So they have to follow the same procedure. And many people ask, why do transit passengers have to do that? Transit passengers may stay here 3-4 hours, sometimes more, and they might even get stuck on the island, meaning that they will leave the airport. At the terminal or in the terminal building, they might be in touch with local people as well. So transits have to go through the same procedure. And if you come from a high-risk country or a moderate-risk country, you will have to upload your PCR as well. If you do not comply or your PCR that you have uploaded does not meet the requirements because it's screened again upon arrival, the passenger will be retested upon arrival. Thank God, so far, the amount of passengers that we have to retest is pretty low. We can still manage that, but we intend to bring it much lower. That's it, Minister. I'll give you the word back. You're muted.
Thank you very much, Dr. Best. In closing, I would like to again emphasize that each and every one living on St. Martin, to do your part, make sure that you adhere to the protocols that had in the past bent the curve, and for us to again get the same situation where the spike that we are encountering right now pretty soon is going to go back down. If you're feeling any symptoms, stay home. Call your general practitioner. If the system deteriorate, check with 914, get some information. Keep your social distancing from 2 meters, 6 feet for anybody. Continuously sanitize your hands by washing with soap for 20 seconds or using hand sanitizers. And please use your face mask to cover your nose and your mouth. It is good for you and it's good for your fellow man. I would like to thank you for your attention. Goodbye.